Welcome back, everybody. My name is Dr. Carl Baird, and today I'll be guiding you through a 15-minute strength routine to help you avoid knee replacement surgery. So as the name suggests, what we're focusing on with this workout is how to build strength and improve movement to limit the impact that goes through your knee so that you could avoid needing a total knee replacement surgery if it is at all possible. And so how we do that is by choosing exercises that strengthen the areas that support the knee without putting too much impact at the knee so that you can build strength without stressing your joints. That's our goal. So with that being said, what we need before we get started is a band of some sort. If you don't have one, I really recommend that you buy one of these bands. We use them a lot. A weight of some sort if you have them. This is just a 10-pound weight. It doesn't need to be super heavy. And then a step of some sort and a chair will also be useful. So I'll let you gather those things and then we'll meet back on our mats. The first portion of our workout will be performed on the ground. So let's go ahead and get to our mat and we'll start on our back. We're gonna have our knees bent, feet flat on the floor, and we're going to start with some glute bridges. So pressing through the feet to lift those hips up into the air and back down. So what we really wanna feel as we perform this movement is our glutes and our hamstrings, but we primarily want our glutes. So a few things that you want to watch out for as you're doing this is if your feet are too far out, you're really going to feel this in the hamstrings, which is okay, but it's not quite what we're going for. If your heels are too close, you might feel a nice stretch or burn in the quads, which again is not what we're going for. So you want to find that middle ground here so that you really feel most of the work in the glutes. The other thing you want to pay attention to is that you're really getting that full hip extension, so you're not stopping halfway and coming down. Really press through the feet to get up as high as you can. And target those glutes. All right, let's go ahead and roll over onto our side. And we're going to do the clamshell exercise. So for this one, you can use your arm as a pillow. You want your hips stacked, knees stacked, and feet stacked. And from there, you're just going to lift your top leg and come back down. So again, this is a pretty straightforward exercise. The only thing you really want to watch out for with this one is that when you come up, you're not opening up so far that you rotate at that lower back. You really want to keep the movement just in your hips. And again, we want to feel it on the outside of your hips here. If it's feeling too easy, something you can do is put a band around your knees, like an 8 or 12-inch mini band. That'll add some resistance, but honestly, I'm feeling it right now. It doesn't take a lot of resistance to get a good amount of work on this one. So again, we're just setting the timer for a minute, not counting reps, not counting sets. It's just do as many as you can with good form in a minute. Good. And then we'll switch to the other side. So you can just roll over. I will flip over so you're not just staring at my back. And then we're going to do the same thing on the other side. So hips stacked, knees stacked, ankle stacked. Keep the ankles together. Don't rotate at the lower back. And you can use your arm pillow here. And again, we want to feel it on the top of our hip. Now, sometimes when I teach this movement, people will say, well, I don't feel it here. And usually that's a problem with, we don't quite have the mind-muscle connection. If we haven't used this muscle or done this exercise in a while, if the form, it looks good and you're doing it like you're supposed to, it's this muscle that's working. But sometimes if people haven't used that muscle, it's like their brain doesn't feel that it's working. So keep doing it, and I promise, if the form looks good, you're working the right muscle, and as you build that connection, you'll really start to feel the work done. You can add a band to feel it as well, but again, I've been doing this for years, and even without a band, I can feel it working the top of my hip, so it's not always that. All right, good job. So that's actually all we're going to do on the ground. So we'll take a quick pause and move to the standing position. I'll meet you there. All right, so we're in the standing position. We're going to start with an exercise called toe taps. So if balance is an issue for you, this is a great one to do starting on a wall. But all we're going to do is start on one foot. So I'm starting on my right foot. Key thing, make sure you have a slightly bent knee, so you don't want a locked out knee because that's going to put a lot of pressure on the knee joint itself. We want it slightly bent so our muscles are supporting us. And from there, all we're going to do is take our left leg, we're going to tap in front, come back to the middle, tap to the side, come back to the middle, and tap straight back. So again, the goal with this exercise is to stand and balance as much as you can on your right leg. So when I'm tapping, I'm not putting pressure on the leg that's tapping. It really is just a tap the toe and then come back to the middle. So again, really good single leg strengthening, which again, if you have an imbalance, you'll probably notice an imbalance side to side. One side will be a lot more difficult. You might even start to feel it on the outside of your stance leg right here. And like I said, if you fall out of it, it's totally okay. All you need to do is reset as quick as you can and start again. But that's why it's good to have a wall if you need. Again, you don't want to lean on the wall, but just having your finger to tap there so you can maintain the position. And good. So we're going to switch sides. So now I'm standing on my left leg, slightly bent knee. I'm going to tap in front, come back, tap to the side, back to the middle, and straight back. So again, paying attention to each side. Again, the one side that you're thinking about a knee replacement might be a lot harder. And that's why these single leg exercises are so important, because when we do our two-legged things, subconsciously the stronger side likes to take over. And so that weaker side doesn't have to do as much work. This forces that weaker side to work just as hard, which is what we want. So again, just have your finger on a wall if you need to. If you fall out of it, reset and start over. Good job. Got 5 more seconds here. Again, we might be feeling it on the outside of our hip. Feel a slight burn in that glute med area. And we're done. Okay, next one. If you have a weight, it does help, not 100% required. This is just a 10-pound weight. But what we're going to do is a weighted march. So I'm going to hold the weight right in front, and I'm just going to march in place, lifting one leg and coming back down. So again, this might be difficult if you have a good amount of arthritis in your knee. So you might just start not lifting your knee quite as high. Just do it. But the goal is to get your hip flexed to about 90 degrees, be able to hold it for a second and come on down. So again, weight not 100% required, especially if you're struggling with the balance aspect of things. It'd probably be better just to do the march and hold on to the wall. But if your balance is feeling good, adding a little bit of weight gets the core involved, which is why I really like adding a little bit of weight. You can hold it in front if you want. You can also hold it to the side. Just make sure that you do both sides equally. So that is our weighted march. And from there, we're going to move to our hip hinge. So this is where we're going to use our band. Again, not required, but it does add resistance to the movement, which is what we want. So to perform this movement, you're going to grab each side of your band. You're going to step right in the middle, feet hip width apart, holding the band at your side. And so what you're going to do is reach your hips towards the wall behind you to feel that tension in the hamstrings and come back up. So this is what we call a hip hinge movement, and it is really, really important for anybody with knee or back arthritis, because what it does is it teaches us to keep the work in our hips. So our hips are our weight-bearing joints, and we really want them to take most of the brunt of everything we do. Sometimes when people bend down, they start with their knees like that, and if you have knee arthritis, that is most likely going to aggravate the knee. So if we can Send our hips back, engage the hamstrings. That's going to be a lot easier on your knees, which is why anybody with knee pain, knee arthritis, you have to understand the hip hinge. Nice work. And last one here. Done. Okay. Next, we'll be using our box. And I'll show you a couple variations. This might be too easy. You might not even need a box. But if you have moderate to severe knee arthritis, you might not want to perform a full squat or you might not feel comfortable. So this is a great place to start with an exercise called the sit to stand. So we're going to start sitting on our box. And all we're going to do is press through our legs to come to a standing position. And then again, we send our hips back to sit in the chair and sit all the way down. So the one thing we want to avoid when we're doing this exercise is using our momentum, which maybe you've noticed this is how you get up off a chair or a couch, where you lean back and then you use your momentum to sit up. Not what we want. We want our muscles to stand us up. So we're going to press through our feet and our legs so that our muscles are the ones standing us up and not the momentum. And again, if that feels too easy, you don't have to sit all the way down. You can do what's called the box squat and just tap your hips on the chair behind you, or do an air squat if you feel comfortable with that. But the best place to start if you're not feeling quite comfortable is with the sit to stand. Good job. All right, our next exercise is going to be the step up. So I'm going to start with a simple yoga block, a 4-inch block. So depending on your ability level, the lower you go, the easier it is. And if you have moderate to severe arthritis, I would start low and work your way up from there. So to perform, pretty easy. We're going to press through the top of our foot to stand up and come back down. So really the only thing that you're watching for in this, and this happens if you favor one knee, is that you're not toeing off your back foot to stand up. Again, we want our top foot to be doing the work. And if this is too easy, the first thing you could do is increase the height of your step. And if that's feeling too easy, you can hold weight on each side. And if that's feeling too easy, add more weight. So that's what I love about the step up exercise is, one, it's very limited impact on your knee. And if you feel like it's too easy, it's pretty easy to make more challenging. But I recommend that you start with the low height, no weight, make sure that you're able to do it, and then progress your way up as you feel more comfortable. Good job. And then we're going to switch sides. So again, if you have one side that's harder than the other, similar to the toe tap, is that these single leg exercises are going to force the weaker side to work just as hard to correct that imbalance side to side. And that's really going to be important for limiting impact that goes through your knees. Good job. This is going to be the last exercise of our routine, but what we're going to do is start back at the beginning. We're going to go through it 2 rounds. Should be about a 15 to 20 minute workout, which is usually good enough to target those muscles that we're aiming for. Just paying attention to what your body's telling you. Is one side harder than the other? Again, it's not good or bad. It's just the more you know about your body, the better. The more you can know about your body, the more you can tell when you're improving, because you could do this exercise for a couple weeks and then realize, oh, hey, wait, it doesn't feel as hard on my left side anymore. Amazing. All right. Good job. So that's our whole routine one time through. I am going to meet you back on the ground, and we're going to start again with our glute bridges. All right, so we're back on the floor, and we're going to start round 2 with our glute bridges. So again, on our back, knees bent, feet flat on the floor, and we're going to press through our feet to lift those hips up and bring them back down. Just making sure that you get that full hip extension by really pressing as hard as you can at the top. You can even do a little squeeze if you want to help. Again, feel it in the glutes. Making sure our feet are in the right position. So just a reminder, if your feet are too far out, you might be feeling it in the hamstrings. If they're too close, you might be feeling it in the quads. You want to find that nice middle. Press up. Your hands, you can really do whatever you want. Leave them on your stomach, your chest, leave them out at the side. Actually, if you want to make it a little bit harder, you can create a little bit of even more tension by pressing your hands, 25% in the ground. That creates tension in the upper body as you press up. So you get kind of this full body strengthening exercise. It's a fun little variation if you're feeling up to it. All right, good. So then let's roll over onto our side and do our clamshells. So again, arm is a pillow. The knees are out in front of us, hips stacked, knees, ankles stacked, and we're just lifting that top leg. So what we want to feel is this muscle on the outside, your glute med, really important muscle for knee strength. And it's not one that we use a lot throughout the day. I mean, obviously you probably don't do these type of movements. It's more straight and forward and back throughout our day. So it's important that in our strength routine, we add something like this. What it does, I'll show you in the toe taps, but what it really does is it prevents your knee from caving inward. So if we have weak glute med, what happens when we're walking, running, is that our knees cave inward. That's more impact at the knee. That over the course of many months, many years, leads to the arthritis. But we're going to fix that. Good job. All right, so we're going to switch sides. Again, you can just roll over. I'll switch sides here. Using my arm as a pillow. Knees out in front, everything stacked, and we're lifting this top leg. Good job. Again, if this is feeling too easy, you can add a band. They're like the 8-inch, 12-inch little circular mini bands you've probably seen from maybe some physical therapy you've done in the past. Pretty common in that setting. But again, I use it here. They're very effective for adding resistance to target, especially these smaller muscle groups like your glute med. You might be noticing that round 2 is a little bit more challenging than round 1, which is why I don't always use the band until you've done 2 rounds, and then you say it's too easy, because sometimes it's that first round is pretty easy. The second round, you're like, oh, okay, maybe I'm not as strong as I thought. I got to work on this a bit. Good job. Again, the only thing, making sure you're not twisting at that lower back. All right. That's it for our floor routine. I'll meet you back in the standing position where we'll do our toe taps. Once you've made your way to the standing position, we're going to start with our toe taps. So as a reminder, we'll start on our right leg. Again, slight bend in the knee. Do not lock it out. That's going to put a lot of pressure on your knee joint. So we want that slight bend in the knee. We're going to tap in front, come back to the middle, tap to the side, back to the middle, and straight back. So again, just a reminder, all we're doing is tapping. I'm not putting any weight on the toe that's moving. The work is being done on our stance leg. And again, it's working that glute med, which we just did in our clamshell, to prevent that knee from caving inwards. That's what I was mentioning before, is that if you have a weak glute med, anytime you take a step, your knee can kind of cave inward like that, which again won't cause pain right away, but the more months and years that you move through your life like that, the more arthritis pain you're going to have. So that's why we do these exercises. Just a reminder, you have the wall right next to you if you need. Okay, to just put a finger on the wall. Again, I'm not leaning on the wall to do this. It's just my fingers there help support. Okay, let's switch sides. Slight bend in the knee, left side, tap it in front, back to the middle, tap into the side, back to the middle, and straight back. Good job. So I ruptured my Achilles on my left side. This was, back in 2007, so long, 17 years ago. But I can still feel a little bit of a difference side to side. If you look at my legs, you can tell there is a little bit of an imbalance. So I always try to include these single leg exercises like this to help as much as I can reduce that imbalance. Good job. Again, if you need to hold on to something for balance, you just slightly put your finger on it. You don't lean all the way up against it. We got 5 more seconds. And done. Okay, we'll go ahead and pick up our weight if you're using it, and we'll start with our march. So holding the weight right in front, a slow and controlled march, lifting your leg up, holding for a second, and coming back down. So what we're really focusing on is slow and controlled movement. And again, if we don't have the balance or strength to get our hip to 90, it's okay. If we just do small marches like this, as long as you don't stay there. Again, every time you do this workout, try to lift the leg a little bit higher than before so that you're always improving. And again, you don't need a weight for this, but the weight gets the core involved so that you strengthen your legs, improve balance, and build core strength all with one exercise. 3 birds, 1 stone. That's what we like. All right, good job. Let's go ahead and grab our band if we were using one. And we're going to do the banded hip hinge. So again, holding on to each side, stepping on the middle. And what we're focusing on is reaching those hips back and returning to the starting position. Good job. So again, this is what we call the hip hinge, is what we call a movement pattern. It's not real, it is strengthening, that's why I have the band, but what's more important is getting this movement coordination down so that the movement is sending the hips back and it's not bending your knees like that, which is going to put a lot of impact on your knees. And once you start doing the hip hinge, what you'll realize is you use this movement a lot throughout your day. And so we want to make sure that we're doing it in a way that protects our knees and protects our low back. Nice work. All right, we're almost there. We're going to do our sit to stand or whatever variation you were doing. So again, starting on your seat, pressing through the legs to come up and coming back down. Good job. So again, just a reminder, we're not using momentum to stand up. We're pressing through the feet to stand up. Now, some people, if they have more advanced arthritis or pain, even this can be difficult. And if that's the case, what you can do is hold on to like a TRX, or like if you have a counter in front of you, you can hold on to that. That's just called an assisted sit to stand. Helps you perform the movement as you build strength. And then the goal is obviously to slowly start to decrease your reliance on that assistance so that you can do it with just your body weight. Good job. 5 more seconds. 1 more rep. And good. All right, our last exercise, we're going to go back to those step ups. So again, whatever height, whatever weight you're using, you're going to start on my right. Actually, let's start on my left. We're going to press through this top foot and come back down. So again, Building that single leg strength to improve balance side to side, which if you have arthritis on one side, there most likely is an imbalance. And so that's what we want to improve to limit impact that goes through your knee. Make sure we're doing everything we can to avoid knee surgery. One thing I'll say about the knee surgery too is it's not always a fix-all, right? Sometimes your doctors or other people's doctors that I've talked to have kind of sold the knee surgery that, hey, you have knee pain, we'll replace it, and when we're all done, you won't have any knee pain before. And what I've seen and what studies have shown is that that's not always the case. A lot of times you get your knee replaced and the pain is still there. You're still not able to do your favorite activities because we haven't learned to move or build strength to support those muscles. Good. Let's switch sides. Went off on a tangent there. We did 5 seconds extra on that side. We'll do 5 seconds extra on this side just to make sure we're even. That's just important to keep in mind because, again, a lot of people that come to me thinking about knee surgery, they're not often told that it doesn't always fix the issue. Again, it's a big procedure. There's a lot of recovery time. There's a lot of rehab time. And then if it doesn't fix the issue, it was a big cost without the benefit, where maybe all you needed to do was improve movement and build strength, especially if your goal is just to remain functional, be able to do stairs, be able to go for walks, be able to sit down without pain. Like, that's most people's goals that are thinking about knee surgery. And you don't always need surgery to complete those goals. Good job. We got 5 seconds left. Here we go. 2, last rep here, and 1. Nice work. Congratulations, you finished our 15-minute strength routine to help you avoid knee replacement surgery. So just as a reminder, what we were accomplishing is improving movement and building strength to limit the impact that goes through your knee, to prevent your arthritis from getting worse, so that we can avoid knee replacement surgery altogether. So if you did like this workout, what I would recommend is that you do this 2 or 3 times a week. Remember, we don't just build strength overnight, it takes consistency. And so performing this 2 or 3 times a week for a matter of weeks to months, just depending on your ability level. And I can guarantee you, you'll start to see some improvement, not only in your knee pain, but how you function and move throughout your day as well. That's all I got for you. If you have any questions, leave them in the comments below. Thanks so much for watching. Hey guys, it's Dr. Carl Baird here, and I wanted to thank you for watching our previous video and supporting our channel. Now, if you're somebody who's looking to build strength to solve joint pain, keep active, and maintain your lifestyle as you get older, be sure to subscribe to our channel to watch all of our new videos. You won't find it anywhere else.